So I come in here like this. That. About to do what's called a crane lift, where literally I'm going to go down, grab the area on his spine that has rotational scar tissue from the left shoulder. Whether that's his lead shoulder, years of repetitious motion that's brought on unhealthy biomechanics. So this move we do when someone is doing a lot of things outside of here that bring rotational stress. Good. And they have deep scar tissue. And we want to correct that. Good. So I'm going to come in here, Mike. You're going to feel a little weight here like this. You're going to feel me move around just like that. Perfect. So what you're looking at here, Jeremiah, this is a flexion distraction extension table. And I got a lot of modifications to it, just like people modify their houses, boats, cars. I've done that over years because of all the different size people I take care of. And it's very important to elongate the body, but open it and then move it. And we're meant to move. So the extra long stem, the different size pelvis plate, and the long handles is to lengthen the body. So breathing on this table, very important in a specific way to where you can feel pressure build up in the tailbone and then exhale. Because when we go to decompress the spine and the entire body and reinforce curvature, the body produces and secretes CSF, cerebrospinal fluid. Very, very important. That's the neurological wet fluid that transmits messaging. So Mike boxes a lot, and he's developed different distortions based off those positions. So I don't want people to change their lifestyle habit. He loves it. He's got to do it. Yeah, but he's a very intelligent person. And if he's going to do that, then there's going to be something that he's going to have to do to balance that. Because if that stays crooked, that's a scoliosis. People that push premiums on things, they know everybody that's been medically diagnosed with scoliosis, their premiums are typically higher.
Your organs will be.
They're pushed.
Yeah.
They are pushed out of the way.
If you don't correct
yeah.
You got to correct that.
Yeah. You can look it up. It's unbelievable. Drop this arm here. Healing. There we go. Good. What you see me doing is setting his shoulders. So biomechanics, the head and the neck sit on top of the shoulders. You want to clear the shoulders out with a man that has girth here and broad shoulders, because most of the time they have cervical ribs. Mike does have one. That's where the ribs are up one level, then T1, which is thoracic 1. So you always typically, as an athletic doctor and someone wants to really get a correction, Mike will come in sometimes, guys, and he'll have a pattern that's outside of his normal pattern. And when he initially dropped weight, his ribs would lock up a lot, because when someone's on the nutritional program, there it is. Wow. When someone's on the nutritional program, yep, the scar tissue and the weight comes off, and we're bringing new life to it. And that's where getting adjusted is really important. And that's where people all over the world that I talk to, I mean, they don't have to fly in to see me. Just find someone that's gentle, that's going to show you a lot of compassion and empathy. They have some type of scientific system of how they evaluate. And then, hey, trust the process. And if it's not for them, then move on. But the body has to get movement. Okay, ready? My hands come in here. All right. Trust the process. Take your breath in. Exhale. Look to the left. All the way. Good. 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 Big breath in. Hold it. Hold it. Good. Ready? Exhale. Sit. Bring the arms right there. You're going to push the head down, okay?
Yeah.
This is a side posture position. It's not corrective. It's a big relief and release, but sometimes when the hips are still stuck and over-rotated, push the head down. Perfect. You have to pull the torsion off the hips and the spine. Now we're going to go back into what's called front to back, which is corrective. Okay, ready? We're going to do this again. Turn your head to the left. Good. All right, leave this hand like this. I'm coming up. Let me have the arm. Yep. Breath in again. Exhale. Awesome.
Hey, I'm Michael Wilson. I've been seeing Dr. Leon probably for the past 2-3 years. I'll come here probably once a week or when I need to come, because I'm a person that's pretty active and still explore the kid in me, and he have to fix a lot of things that's wrong with me. I have calf injuries that he have fixed. neck injuries that he had to fix every week because I box and I get hit upside my head sometimes and from flinching. Hip injuries, lower back injuries, just my whole body he keeps correct. I just would like to tell you guys that if you can come in here and you'll live a different life. You'll live a very active life. People have seen me and said that I have been aging backwards. I'm real active. Also, the dietary part of it. The dietary part, I started off at 271. I go between 243, 247, anywhere up in there right now. And I go off my chart. I'm not one of the most disciplined people with doing what he tells me to do. But then if I do what he tells me to do, my body goes right back into where it needs to be. No inflammation, no more headaches, what I used to have. And a lot of the food that you think is good for you, if you get the dietary blood work done, a lot of food's not good for you. See y'all soon. I don't like to micromanage nothing. But if me and the team got to play and I got to lead on it, I'll lead or I'll follow.